joining the Popaholic first Popaholic 2024 show. This show is very important for several reasons. And if you have not attended Popaholic show before, Popaholic is a podcast that only focuses on health issues and social justices. So we invite experts in different fields in variety of topics in public health to come in and discuss either their work research or their academic research. In this case, we have the pleasure to invite Dr. Florence Mbangowah, who had done a lot of work on HIV, and the work she did is very, very important. She did this work on HIV among African American women. And we're gonna dive into it and talk more. But before I start, let me actually introduce her, and so that the audience will know her capability and what she has done in the society or continue to do. Now, currently, she works for Disease as a director of operations and clinical manager. She conducted her study on HIV, as I said earlier, among African American population here in the United States. She has worked with SACS and Sequel companies since 2012. She also worked with COVID-19 immunization clinics as public health advisor, contact tracer, and educator. She is proficient in qualitative and quantitative data management, currently teaching nursing students basic medical science with a 99% first-time exam passing rate. She provides directions and mentorship to students, educates the clients on the expected side effect of vaccines, interprets complex laboratory results based on case management definitions and disease control procedures. Overall, Dr. Mbangowah is a seasoned healthcare professional with over 15 years of combined experience in teaching public health epidemiology, infection control, pediatrics, hospices and palliative care, and rehabilitation. So this is a brief summary of Dr. Mbangowah's work. But before I turn it over to Dr. Mbangowah, I want to discuss a little bit about HIV. Last year, I invited another expert that had done work on HIV and AIDS in different continents, actually, in different areas. And this time around, I invited Dr. Mbangowah, not because that she has done this work, but because it has been over 45 years since, HIV. So what I want to actually discuss in here is also to give basic information about HIV before I turn it over. This is it attacks the immune system. I think everybody by now knows this. It also leads to, if untreated, leads to AIDS. There is no effective cure currently that we know for HIV. It doesn't exist. There's few areas where the news say, some few people no longer have HIV viral load or whatever. We don't know what's going on, but there's no cure. However, there's effective therapy to manage the viral load. Think about this. There's the reason also this is important. Her work, Dr. Mbangowah's work, is very important among African American women. Is that Black African American population here in the US is only 13%, but in fact, among African American, they account 42%. 42%. Think about that, of the population in the United States that have HIV. So if you think about proportionality, that's not proportion, right? So, and in 2020, African Americans were 7.8 times more likely to be diagnosed with HIV. And African American males have 8 times the AIDS rate compared to white male. African American female have 15 times the AIDS rate compared to white female. African American men are 6 times as likely to die from HIV infection. And African American women are 15 times as likely to die from HIV infection as white women. So now, if you look at the prevalence of HIV by sexual orientation, we see that over 70% of total population, this is 2019 data, that has HIV among gay, bisexual, and men who reported male-to-male sexual contact. 22% are among heterosexual, and 7% are among those that inject drugs. I mean, this will be important discussion when I turn it over to Dr. Mbangowah. Now, if you look at United States as a whole and break down the regions of the United States by Mid-East, Northeast, West, and South, the highest population with HIV is in the South.
Mute yourself, please.
Okay, so, and then we move forward to what I already discussed. So if you look overall, African American male compared to white male, and you do the stratification here, you will see out of the 100,000 population, if you look at white male getting HIV, whenever one white male gets HIV, 8 African American males are getting HIV. If you do the ratio for African American female, every single time one white woman gets HIV per 100,000, 11 African American women are getting HIV. So the overall, if you combine the gender, whenever one white person gets HIV in 100,000, 8 African Americans are getting HIV. Now, if you look at overall rate of African American HIV infection cases, is 40% compared to 28 or 20. If you round it up, 29% white population. Then AIDS. Also, you see the disproportionality. For every one white person in 100,000 population, 8. For every one person, white female, in every 100,000 population, 15 African American women. The combined is a ratio 1:9. Now, cumulatively, the same thing, AIDS cases among African American as a whole is 40%, and among whites is 33%. I mean, the reason I can do this comparison with other racial groups, we usually standardize using white as standardized comparison for most of the stuff that we do in public health and epidemiology. If you look at AIDS death rate, 40% among African American, 38% is close to white population. And then if you look at the testing, this last slide I'm showing is important because Dr. Mbangowah's study is based on HIV education and testing. So if you look at testing and look at among African American, non-Hispanic, Black that have ever tested for HIV, you look at it, it shows that is 63%. Those that have never tested is about 37%. If you compare it to white counterparts, it's 41% for those that tested. So testing, to me, looking at this, is not really the issue because you can see the testing, right? But we will talk about this more. So I don't want to jump the gun. So what I will do now is turn it over to Dr. Mbangowah to present her study, and then we will come back to discuss the testing and why we are having this issue among African American population. So without further ado, I'll turn it over to Dr. Mbangowah to probably give shout out to people that have helped her do this study, and then she will turn it over back to me. Then I'll start posing the questions that I want us to discuss. Go ahead, Dr. Mbangowah.
Good afternoon, everybody. Welcome to the public. This is the first one in 2024, and I said I'm privileged to start it. I want to give a shout out to all those who assisted me to do this. It wasn't an easy task, but the first shout out went to my husband, Eric Mbangowah, because he misses me a lot when I was doing this study. And then to my children, my 4 kids, unfortunately, they could not see me. I could not cook for them most of the time. And my friends misses me a lot when we used to have fun together. My Hope population from Hope Presbyterian Church, I did not do a lot of things. And also, even Dr. Omelu guided me a lot in this study. And I want to give a shout out to everybody who is here. We want to feed our minds and we want to educate the population that is out there. Thank you all for joining.
Thank you so much for that warm greetings that you just presented and all the people that supported you throughout this work. Your work is very, very important in the community, not just in the United States. I think it's a primer for other countries and the global community to look into and start working towards creating health equity in the communities, whether it's by race or by any other category. It is important. You know, we're in the 21st century, and this level of disproportionality in any type of chronic condition should not exist. So that being said, I want you to start us with just discussing the problem that you encountered in this study in terms of the problem that exists within the area of HIV, education and testing, background and purpose and significance of your study. Can you start us with that, please?
Yes, thank you so much. This study, the topic was the impact of education on HIV testing among African Americans women in the United States. And the problem that made me to do this study was I did the risk assessment, which was health education, which is very important for African Americans because we don't read a lot of stuff. We look at the stuff, we don't read it. HIV testing and in African American women is very, very important. Most of the time, African American women, they don't go early to go test themselves. They wait until when the viral load is too much, then they'll go there when it is late. So with this education, they're going to learn to help this risk assessment, to know their general health problems, to know the rate and know that African Americans, if they have education and they learn, it helps them a lot to reduce these numbers that we have, like this large percentage that we have among African American women that have HIV. And then when they don't go to that testing on time, it leads now to AIDS. And when once it comes to AIDS, then we suffer, our families suffer, and we have even mental issues concerning this. So the background of this study, HIV is a major health issue, and it has caused a lot of harm to a lot of us. So economically, mentally, even the income-wise. This study was done with African Americans, women age 30 and above. And why did I pick this age group? Because that is the age group that is really productive. That is the age group that they have gone to school and finished school and they are supposed to work and support their families. That is the age group that they are thinking, they are matured in their thinking, and they can do a lot of things to help the society. But when this HIV comes and then it affects them, it is a big problem. In addition, HIV affects low-income racial minority families. Why? Because they don't even have the means of reading to have that literature so that they can go and test themselves. Secondly, they don't have the money when they get the HIV to buy the medication, so they don't get tested on time, and then it now resolves to AIDS. So with education and them having a lot of understanding, they will now prevent a lot of issues that were supposed to come into families and bring about this HIV and bring about low income problems, and even bring about mental torture, which does not only affect the person that is having the disease, but it also affects their families as a whole.
Thank you, Dr. Mbangowah. And there's a few things I wanted to clarify because I want everybody to be on the same page. Okay, there's huge difference between academic achievement and health literacy or health education, right? Dr. Mbangowah's research, even though she gave the definitions of what she's doing in terms of education, Dr. Mbangowah's research focused specifically among women, African-American women that have completed high school, college, and higher academic achievement. And for you to get people that will represent each of these academic achievement group, you have to go a little bit up in the age group, right? So that's why she basically selected 30 years and older. You know, you can do the math from high school, 18 years old, you go to college, graduate around maybe, if everything goes normal, 21, 22, and then you go postgraduate and, you know, takes another 4 years, you're looking at 28 and so forth. So that's why. So I want to make that distinction. Now, you can still be educated, go to college and do all that, you still have lapse in health literacy. So when we're gonna discuss more about this will be when she showed our result, and then we will begin to understand the difference of what academics can do in population level and what the lack or lapse of health literacy can do in the society. So that being said, let me move forward based on what I just said to ask Dr. Mbangowah to actually describe the research questions that she focused on in conducting the study, the methodology she applied for the study, and we will discuss the findings and social implications.
So this research, I had two questions that I took into consideration. There were two research questions, and the question one was, among African American women age 30 and older, is there a significant association between HIV test participation and educational level? This educational level is high school, college, or post-college level, which is a grad school. And this is based on access to healthcare after accounting for insurance, income, employment, and marital status. That was the first question. The second question that I looked into was, among African American women age 30 and older, is there a significant relationship between educational level, high school, college, post-college, Those are the educational level. And HIV test participation based on English proficiency and vision quality. Those were the research questions that were addressed on this study. And then the social implication of this research question was the study significance, which was social change implication. Increase in HIV test participation improves social behavior, perception of the disease process. Also, it affects communication process, provision of care and support services to reduce HIV or AIDS-related stigma in our community. Because that stigma brings about discrimination, it dehumanizes people who have HIV. Sometimes these people have mental and physical torture just because of the way we treat them in the society or in the community in which they live. Because we know that they have HIV, we turn in treating them in another way. And then it is also, in another significant and social implication, it will promote and tailor education to culturally competent individuals. The educational material that will be used will be coined to suit those in need. And those in need for this purpose of this study are the HIV, those African American women aged 30 and over. It will also, the material will also focus on the target population. And this target population are the vulnerable population, who are the low-income people, and they are African Americans in particular. Again, I know we already talked that the purpose of this study was focused on African American women aged 30 and older. How were they evaluated? The evaluation of this current research question, it accounted for healthcare, insurance, income, employment, and marital status. The reason why it accounted for healthcare, income, employment, and marital status, it ties with the age group. Because at age, when you already graduate from grad school or high school or postgraduate, you are the one that you can educate your family. Now you are looking to see if you can get a better job to get health insurance. Now you are bringing income into the family so that you can make your own family. And now most of this population, they get married so that they too can bring up a healthy family. So for the purpose of this question, this research, a theoretical framework was used, and this theoretical framework was the integrated theory of health behavior change. The integrated theory of health behavior change is a very good example of individuals to foster knowledge for themselves so that that knowledge can help them in the context of working directly with other patients and patient-centered care. Means you work with the patient directly, center on that patient, because even the AIDS that we get, the HIV, we have different viral load if you are diagnosed. Because some people have a higher viral load than others, when we use this theoretical framework, we now treat people according to their own viral load. And then we also promote healthy behaviors and quality of life. And then this also theoretical framework will also help the application of integrated theory of health behavior change can be used to explain factors associated with low adherence of HIV test participation among this age group. It can also be used to explain patients' behavior to understand the scope of health education and HIV test participation among African American women.
So that being said, Dr. Mbangowah, now just in a summary way, you conducted your study among African American women in the U.S. Ages 30 and older. Your focus was educational level, academic educational level, high school, college, and post-college level. That's the primary, what you call the predictor variables. And then you also accounted for insurance, income, employment, and marital status as a confounder, right? That's your first research question. I'm just giving a summary.
Yes.
And then your research question 2, what you looked at is among the same age group. And we already discussed why you selected 30 and older because of the academic achievements. And then it's the same 30 and older. You looked into the relationship between the same academic group, high school, college, and post-college level. But then you are accounting in terms of confounding, you're looking at HIV test participation, accounting based on English proficiency and vision quality. Okay, so now take us through these 2 research questions. First, looking at research question 1, what are your findings in looking at this group of women, African American 30 and older, in different academic group, accounting for their insurance, income, and employment and marital status? What is the finding? How education, their own academic achievements, influence whether they participate, at what percentage and significance does it play in terms of testing? And then you go and do the same with research question 2.
Yes, thank you so much. In research question 1, which says among African American women age 30 and older, is there a significant association between HIV test participation, educational level, based on access to healthcare after accounting for insurance, income, and employment? There was no significant association amongst African American women age 30, older, between age 30 and older. HIV test participation, educational level, and based on access to regular healthcare facility after accounting for that. This, when I look at the study, there was no significant among this age group, this question 1. Then when we went to the question 2, among African American women age 30 and older, is there a significant association between test participation based on English proficiency and vision quality? And then when we went to the null hypothesis, there was a significant relationship among African American women age 30. The null hypothesis had the significance. So in this also, I used binary logistic regression was performed to determine whether educational level could be associated based on HIV testing after controlling for access to healthcare coverage, income, employment, and marital status. The result of this logistic regression indicated that educational level is not significantly associated with HIV testing. So in summary for these two research questions, the result of this study aim at examining the relationship between HIV participation and educational level among a sample population of African American women showed there is no significant relationship between HIV testing and educational level after controlling for access to healthcare insurance coverage, income, employment, marital status.
Now that you discussed your findings, can you please just run us through, the lesson learned and the practical application of this finding that we just clarified in public health, clinic, and community setting?
In this study, I learned a lot. The findings from these studies are very valuable for the society, in our society, and the community at large. The need for people to undertake HIV testing is very important. Another one is an understanding of the factors that determine whether people go for HIV testing is very crucial. Supporting an initiative and encouraging early screening among African Americans, and even not only African Americans and the community in which we live. African Americans, male, females, white population, Hispanic population is very important. Another one is the importance of education is highlighted in the study finding, in the sense that with more education, people are more likely to care about their lives and participate in going to see the physicians early and be open to discussion, and even taking away the stigma and getting that education to take medication at an early age. Because when you take the medication at the early stage of the disease, it helps you and it reduces that viral load that is supposed to be up. Another one that I really learned that is important, this information encourages members, not only African American people, the community, to support and promote increased education in the community and everywhere that we live. There is a close association between health literacy and encouragement in intervention that seeks to reduce the prevalence and impact of HIV among African Americans. This study did not go without some challenges. We also had challenges and limitations. The challenges and limitations of these studies were the data that was used was secondary data collected by other people, collected for some other reason, collected and you don't know what the situation that the people were in it when they were giving that data at that time. And then another limitation was the cross-sectional design that was used. Only correlational inferences were used. Self-reported survey, lack of clinical data to support the responses. Because when you give them a question, they answer the question based on what you have given them. They were not able to explain themselves. Another limitation was the recall bias, and then misclassification of the bias also. Then lack of generalizability was also a concern when I did this research.
Thank you so much, Dr. Mbangowah, for this. Now, what I'm gonna do, I will now open it up for open discussion. But for me, this study is very important in the sense that it deals with academic achievements. Academic achievement here include high school graduation, graduates, college graduates, and post-college graduates. What I need to open it up for a lot of people to discuss this. I still have concern about the high prevalence of HIV among African American population. There's something going on, and if anybody is still doubtful about what's going on, then that person have maybe something internally they have to go and discuss within themselves what's going on. But what I'm saying, social level, social construct level, there's a problem. We have a problem in the United States. There's no way anybody can convince me 45 years after HIV and AIDS pandemic, the disparity, the disproportionality of the caseload of either HIV or AIDS is still too large to even close between African American population, in this case African American women, closing it with white counterpart that I just showed in here. Like I said earlier, academic achievement, whether you get PhD or college graduate, doesn't automatically translate to health literacy. These things are two different things, right? And the reason why this is very important to me is that if we say let's forget about HIV and let's look at any other chronic condition, let's look at diabetes, let's look at cardiovascular disease, let's look at cancer, breast cancer or colorectal cancer, we see the same thing. So this is not just one-off. This is not just, HIV, due to the behavior. No, it's not one-off. This is a population issue. This is an American issue, and that needs to be fixed. And that should not be fixed by just standby observation and making all these distraction noises. We have to look at the data. Data informs population health. Unless if we say, let's throw out data from public health, let's throw data out from research, let's throw data out from any type of scientific research, then we will all agree on this as a society that data doesn't mean anything. So that being said, I will open it up for people to either pose a question and then make a comment. So I'll leave it open now for everybody to make a comment.
Before we pose the questions, I also had a few things that I want to give to the audience concerning this, because we can make a difference in one person's life in one way or the other. And the things that I want the audience to take home and help this population, why, to answer this question that Dr. Omelu just said, why is it still this high number among African American population? I want to say that the first thing that we should take home is informed decision making. We should teach our African American population and everybody that comes around us to make sure that they know these informed decision processes. We should also help them to know the evidence-based policy initiative and implementation. Because lack of these things, no matter what we do, will not help in any way. We should also teach them that regulation and safety is very important when it comes to the reduction of HIV in our community. Safety comes first in everything that we do. And in every industry that we work in, safety standards need to be implemented. Another thing is that technology is improved daily. When you feel somehow in your body, check it out yourself before you even go to the doctor, because sometimes they are busy. They don't catch it on time also. Depending on how you present yourself and what you say. Use the technologies that we have around us. Google stuff, read it, ask questions. And then above all, lifestyle and behavioral changes are very important. The way you make your lifestyle. Most African Americans, when I did the research for these studies, I see that even those that they catch the HIV on time don't have time to rest. They don't have time to take care of themselves. They don't have time to take the medication on time. They don't have time to do follow-up with their doctor's appointments. Thank you all.
Okay. Thank you, Dr. Mbangowah. And there's area of preventative measures, pre-exposure to HIV. There's area intra-space of HIV, meaning that you already got HIV. And then the question becomes, are you in adherence with what you're supposed to do? Take medication, lifestyle improvement, increase your immune system, that area. And there's post, right? So all these are connected. So put all the whole health condition, and maybe I will do it this year. All the whole type of health condition, including infectious disease, chlamydia, even diseases that we know now we have cure for, gonorrhea, chlamydia, here in the United States. You look at it in California, you look at these numbers, you see it's, huge in African American population. It's not even close in terms of comparing to white counterpart. Now I'm talking about curable infectious disease. So there's a systemic issue in the United States that we need to focus on and ask ourselves questions. Why is this happening or continue to happen? Has it come to the level where the society as a whole need to wake up and start asking their local governments, state government questions and holding them accountable about this disparity? So that's where I'm really disappointed in a lot of, based on my experience, that regardless of what health condition is, I see this a lot among African American population, and not even to mention American Indian population as well. So did anybody have any questions or comments to discuss on what we have discussed? I know you guys have questions. I know you guys know a lot about stuff. So please don't keep silent. We need to discuss this. Change starts from discussion. That's why Papali promotes healthy discussion, healthy people, and healthy environment. It starts from discussion first. Let's start discussing this.
I'm sorry, somebody put a chat that I should share my screen. I didn't see that, I'm sorry. I only saw the chat now.
Any comments, any questions? You're not going to tell me you don't have any questions about HIV and AIDS?
Yeah, indeed. And Dr. Mbangowah, I have a quick question. You talk about education, and it looks like the higher the level of education, the better off you are in going and being tested for HIV. Now, I still would like to understand, so people above 30, is there a difference between people who finish high school, people who finish college, people who finish a PhD, for example? What I'm trying to see is that, are there degrees of awareness of getting tested for HIV based on the difference in schooling, difference in education? Has that been done in the study?
Are you asking whether it was done in this particular study?
Yeah. What I try to understand is that people go to school, at least here where I live in Davis, and the schools are mixed. In high school, I don't think there is any discussion about HIV.
Oh.
Let me answer that question.
Okay.
Yes. So looking at the literature review for this research, a lot of people indicated that high school, there's that education is not there in high school, and that is the gap that we have to fill in. Because when we have that gap, and some of the high school students are being tested positive, then we have to close that gap. And how can we close that gap? By starting to give that education as early as high school. Secondly, people, when the more higher you go in education and the age, the more mature you take things. Some, when you are young, they even tell you something in high school. You take it. Sometimes you pass the exam, but you did not even conceive what is there. You were just writing to pass. But that material, when as you are going further, they teach it again. Now you recall and tell yourself, oh, so this is what they meant when they taught this. So the higher you go, the more able you are able to perceive things, and then you analyze it well and utilize it. That's the literature review that indicated in this research.
And now that you brought this up, I know there's people that may be in this platform right now that teaching high school. So this is a double standard I see. I didn't go to high school here in the US, so I don't really know about the high school system. So it's interesting. And please, I'm not against anybody's sexual orientation, because I need to make that disclaimer before this goes out of hand. You know, people like to take things out of context and they love it. I don't know why. But this is the point I want to make. If there is sex education in high school, or what is happening right now in high school regarding teaching students in high school, sexual orientation, pay attention, sexual orientation. You know, I think it's been taught in many high school now. Why is it we are not talking about sex education and infectious chlamydia, gonorrhea, HIV? Why are we not discussing that? If the other stuff can be allowed in high school to be taught, why is this not being taught? That's just a thought, you know. So to also show the lapse, would I say, social ignorance that's happening in the United States right now, right? If you really want to fix a problem, I think the best way to fix any problem, if you can, is to go upstream. We have upstream, we have midstream, and we have downstream. If you always wait to discuss issues at the downstream, you can't solve the problem. So there's people that had hands up. But before I get to Dr. Emenambo, there's somebody that posed a question. I think is, let me go to chat. Okay, it was Katie, Dr. Katie. The question Dr. Katie is posing are there any setting in improving the issue at hand? So, okay, the issue at hand, Dr. Katie, you have to help me here. Can you specify what you meant the issue at hand? And then she went further to say, what are the recommendations to do? So the issue at hand is, I don't know what it is specifically, but she said, whatever that issue at hand, what are the recommendations? So, Dr. Katie, can you please tell me what you meant the issue at hand?
What I meant, the issue at hand is because despite everything being done for the African Americans, we still have the problem of them contracting HIV/AIDS. So I wanted to find out if there's any setting in place that is helping to curb the problem we are addressing today.
Okay.
And then secondly, I wanted to know what were the recommendations, maybe I missed it, in the paper in helping or curbing this problem.
So, Dr. Mbangowah, can you address the
Yes.
question?
The recommendation in helping, the first one was education, creating awareness, and having time for ourselves. And then, of course, everything begins at home. Us who have had this information, we start educating from our homes and going out to the population. And then advocating also, like we're saying about high school education, if we can add this. If we say something and we don't advocate for that, it just ends there. So when we advocate and see if some laws can be changed or implemented, then that would happen. But if we don't do that, it will stay the same.
Okay, thank you so much, Dr. Mbangowah, for that question. There's 2 hands up, or 3. I think Dr. George Emenambu has his hand up, and after that, I'm gonna go to Yvette and then Paul. Go ahead, Dr. Emenambu.
Yes, can you hear me?
Yes.
Right. Yes.
Okay, based on my experience, I'm a high school science instructor. And usually, I don't think the emphasis is laid in they teach health education also. Usually what I do is that when I teach viruses and in comparison to bacteria, I lay emphasis on HIV/AIDS, but I blame the community leaders and maybe CDC not trying to get this to the community because this is pure lack of information. And it takes a lot of effort to inform. You can teach them about HIV/AIDS in a classroom setting, but their parents at home probably they don't have this information. And of course, when you look at your United States statistics, it's very high among African American and also the Latinos. And it has something to do with income. So the social aspect of it is income and lack of information that is not given to them in a community setting. So I think there should be more effort done in Black communities to inform them about this HIV/AIDS because it's still there. It's still there. This is as far back as it started. As far back I was here, as far back as 1983.
Nice. Mm-hmm.
That was when it started with a certain set of gay men here in California area, and then it went into. First of all, I'll blame the president then. I think that was President. I can't remember his name. That he negated that particular aspect of it. They didn't say anything about it until he went into a heterosexual community, and that's what we're dealing with today. So I think it boils down that it's this education, community type of education, informing people of what is the causation of HIV/AIDS and how to prevent it, because as it stands right now, HIV virus has been found in all bodily fluids. And therefore, you have to be very careful in terms of contact with the next person, no matter how close we are. Even mere kissing might lead to the transmission of the disease. How do you know who has HIV if you are kissing someone that you have not met before? So that's my contribution. I think I hold the government, the state government responsible for this continuous spread of HIV. It is something that's applicable in Southern Africa and South Africa. It has something to do with lack of education and ignorance. We have the highest level of infection in South Africa, south of the Sahara. Thank you.
Thank you so much, Dr. Emenamba. I really hear you. And the reason I was also focusing on high school, you know, the system is very, very important in any social cohesiveness, right? You see many parents, or many single mom, single dad, two family homes. You see the way the system is structured, people work. And there's 24 hours in a day, 8 hours you sleep, 8 hours you give to your job. The other 8 hours left, you know, you have maybe 8 hours of there to take care of your family and stuff. But at the same time, your children, if you have teenagers, they go to school. They spend most of their hours in school. You see, so I agree with you. Parenting has to also play a role. Parenting in terms of when it comes to infectious disease or chronic disease, they need to be aware of a lot of stuff, but also to have an integrated society where awareness is transparent. It will also, if it's feasible, because I'm not advocating that everything needs to be taught in high school if it's not appropriate. That's not what I'm saying. But when we see a clear problem in the society, then we need to start thinking innovatively. How can we, you know, mitigate the issue? And that's why I mentioned what I mentioned about high school. So let me move quickly to Yvette. Please go ahead and unmute yourself. And if possible, if you want to be on video camera, go ahead and post your question. Sorry about that.
Okay. Hello. Good afternoon, everybody. I from my last name, you can tell I am Dr. Florence's daughter, and this is a topic that is near and dear to me because I'm also a practicing physician. But my comment here is not necessarily in relation to the concern. My issue here is talking about my experience as a high school student in America. When I came here and I moved right into high school, what I realized was before they allow a student in a class to learn about anything, they have the parents sign a permission slip. Well, a lot of the African American parents always sign their children or refuse to sign their children from participating in health class. You can ask my mom and my dad, they'll tell you, I signed my permission slip to go to that class myself because I knew what I wanted to be in the future. I didn't know what they were going to teach, but I went there. If I went in that class, it was filled with Caucasian students and Asian students. There were rarely ever any African American students or Hispanic students, the people who have the highest amount of HIV on our statistics. That is, and I can't blame those parents. One, there's lack of education, there's lack of trust in the system. That happens. I have patients that come to me, and as a part of their wellness exam, I tell them, this is covered as part of your wellness exam completely. I would like to screen for HIV. And the parents go, no, my child doesn't need it. It's the parent paying for the test. So I can't order a test if that parent says no. But you would not know if you don't screen. That almost always happens in the population of African Americans and Hispanics. If I talk to a Caucasian parent, half the time they even leave the room. They're like, oh, I'm going to let them talk to you one-on-one. But I have that resistance. And I get it. Again, it's a lack of trust in the system. I can't say that I have a good way to say that they can trust the system because there has been a history that has led them to that position of lack of trust. I can only hope that a lot more people that look like us can get into the system and allow for people to trust, because eventually parents that look like me, that have the same skin color, start to trust me, start to allow me to educate them a little bit, and then they're open to the idea. But it's a lot of layers to this thing. A high school student does not always understand. The parent needs to teach them at home, but that parent will not know what to teach them if they're not even trusting to open their mind to learn. If you don't know how it's transmitted, if you don't know that you need to screen, you don't know how to prevent it, you will not even know what to do. So that's just my comment. Maybe continuing to educate the community, maybe continuing to find ways to help people trust, maybe to help people to find people that they trust so that we can work for multiple factors to try to reduce this.
Dr. Yvette Mbangowah, I can't say it better than what you just said. Thank you so much for that inspirational thought and how you put it, because I'm not really practicing in clinical field. I'm an epidemiologist and in public health. So thank you for actually bringing us home again to the historical causation of this mistrust, right? So we know that. I'm not even going to go to the level of Native Americans too. I have experience working with the natives, and I also see that fear among Native Americans as well. So there's no trust in the system, specifically here in the U.S., based on the historical account. And that's where public health will come in place. And that's where enhanced policies can start being made to promote the trust, promote the relationship, and bridge the gap of trauma that has been inflicted through the historical background. Thank you so much. I really appreciate your insight on this. And I will turn it over to Paul. Paul, please unmute yourself and pose your question.
Thank you, Doctor. And thank Dr. Mbangowah, Florence, because we have two Dr. Mbangowahs here, Mbangowah Senior and Mbangowah Junior. I actually babysat Mbangowah Junior, and okay. You can now understand that Mbangowah Senior is my mom also. And so I want to thank Dr. Florence for being the flag bearer of this phenomenon that is almost becoming a canker in our system. I'm actually talking from Massachusetts, Boston, to be precise. And so I have two questions for Dr. Mbangowah, Florence. Did in the course of your study, did you try to find out if this awareness or education and testing are the only predicament or the only impediment to HIV in your target population? Secondly, we know that the PhD work is a starting point. Now that you are teaching and getting involved in many other activities related to your doctorate, do you have any access to policy holders who can help enhance what you are out to change or improve? And do you have other research concerns that you are now carrying out at post-doctoral level for information purposes? Thank you.
Thank you so much for the question.
Thank you. Thank you so much, Paul. I will want to say that HIV is a broad topic. There are a lot of factors that I found. I picked those two to elaborate on. If I want to add others, we can stay here for 10 days and will not even exploit all of them. There are a lot. It just happened that I picked those two to talk on. That's not the only thing that affects. But these two, awareness and education, it can reduce some of the other factors that come with this HIV. So I picked the most important one to me, that I think that if we are aware and educate ourselves, we are going to reduce a lot of HIV in our communities. Second, your second question on, am I working on other researches? Yes, I am working on other researches. Still working on seeing if I can reach that level of getting policy makers or to talk to them and see how we can work together. I haven't met some, but my Congress man in here, we have discussed a lot, but we haven't come to going like giving any grants for me to continue, sorry, to continue research, but I'm working towards that. And I think that with this education and working with Dr. Omelu, we are thinking alike, and we think that success is going to come. Just watch and see, or you join us and we work together. Thank you.
And I agree with what Dr. Mbangowah is talking about. There's big stuff happening right now with my organization, Resilience Coalition. In fact, Florence Mbangowah is part of it. It's about HIV and AIDS project. It's right now happening on the ground. Everything doesn't exist in vacuum. Everything that you see that happen around the world happen because money is involved. Okay, so money has to be involved in disease causation, disease correlation, and money has to be involved in disease resolution, right? So if there's not enough money, things will not be happening, and obviously if there's not enough awareness, things will not be happening. And that's even interesting that she also accounted for income to see the impact of income in HIV participation and testing. So I'm gonna come back to Dr. George Emenambo because he still have his hand up, but let me give other people opportunity. iPhone number 4, sorry, I don't know your name, but I don't want to call you iPhone number 4 because I don't know your name, but you can unmute yourself and be on camera if you want and pose your question. Then after that, I will go to Rosa Obin.
Hi, everybody. So my name is Comfort. Thank you so much, Dr. Mbangowah, for the wonderful presentation. I really appreciate, the time that you've taken to educate us on the importance of education on HIV testing amongst African Americans. So I just have a comment. As a healthcare provider, also working in healthcare, I just want to emphasize that one thing that I've noticed when it comes to just education, be it on HIV/AIDS or be it on other chronic diseases like diabetes, hypertension, or cardiovascular disease, I think it's important that we kind of evaluate the manner in which this education is being delivered. So I think it's an important component to consider when we're talking about how to deliver the education, especially taking into consideration the target population that we're focusing on. So for instance, the manner that as a healthcare provider, I may deliver education to an African American, I think sometimes it's really different from how I can provide the same education to a Caucasian or, to immigrants, like all these different sectors. And I think it's really important to kind of also focus on when we're providing training to these people that are going around doing this education, be it at the level of high school, so be it like health coaches. So I think it's really important to address the manner in which the education is being delivered. Because, a lot of factors that, we could take into consideration, like you want to make the people that are receiving or whatever population is receiving this education, you want to make sure that, it's not all about receiving the education, but it's how to use this education when they've received what you've provided. So it'll be making sure that they're connected to the resources, making sure that they feel safe, exploring or asking questions about HIV. and just making sure that they're well supported, that they know that, if they get tested and, what's the next step? If I get tested and I'm positive, how do I kind of go from here? So I think it's a lot of fear that holds people back once they've had this education. And sometimes even when they know how important it is to get tested, they don't want to proceed because there's so many unknowns, like what if, so if I really get tested and I realize that I'm HIV positive, then what next? I'm going to be all alone. My life will come to an end. So all these thoughts, I think, in the delivery of education, it's important to just make sure that we're, assuring them that there is a good support system in place, the resources, no matter what the outcome will be, and just making sure that they feel like they have a safe place, that they can kind of go to talk to somebody or just a counselor or mentor. So just wanted to add that on there. But thank you so much for the presentation.
Thank you so much,
Thank you.
Comfort. I'm sorry I called you iPhone 4. You're not iPhone 4. You're Comfort. So
It's
sorry
okay.
about that. But thank you so much for that information, because we coined it in public health: culturally informed, or culturally competence, or culturally humility. I 100% agree with you. Any type of education awareness we create in public health or clinical setting or community setting need to be culturally informed. The mistake clinical setting, hospitals, public health had made past 100 years is forcing people to believe in the same thing. The West will want educate Africans on the way they think and the way they believe things. That's a big error. That's a big mistake, right? So we need to start changing the way we think and think the way the people that we want to help thinks. Yeah, I think it will produce more positive outcomes. So I really agree with you on this. We need to, in clinical setting, laboratory setting, public health setting, start tailoring our information to the target population, their way of life, what they believe. It will have greater impact than forcing people to do what you do when they don't believe what you believe. I will also move over to Dr. Rosa Oben. Please, can you unmute yourself? If you want to be on video camera, that's fine. Post your question or comment.
Hi, good afternoon. Thank you, Dr. Mbangowah, for this wonderful presentation. This is a problem that is affecting our community. The last speaker has already said what I was about to add regarding the education, how the education is given to the target population. And I was trying to pick up with Dr. Yvette, what she said about trust. I'm thinking that looking at the population and the morbidity that we're talking about, the HIV and the testing, the fact that it is a social disease, so many, the target population will not want to test. We're looking at education, yes. Like Comfort said, the education, how do we post that education to them? My contribution here is the strategies that we're supposed to educate this population, and based on the community where this education, this target population lives, that's the built environment. I believe that the first thing that we're supposed to do is that trust that is accepted and their readiness to accept what the person that is delivering the education is about to. So I want to say this is a very wonderful work that Dr. Florence has put forward. And with the problem of infectious disease and getting to that target population, we should try to know how to tailor this education to meet the audience and how to present this education to the audience. Again, from what she narrated from her presentation, I know she mentioned about a need assessment. That is where I am looking at. how do we present this education to our target population? The first thing we have to do that need assessment. Need assessment to find out the gap, especially the target gap. What are the specific things that we have to educate them on? How are we going to carry this conversation? How are we going to make them trust us? So that's the only thing I'm trying to add. All the other speakers have already contributed. They have already said it all before I even got to say it. So we just have to look at how we tailor this communication to this target audience, the strategies that best fit what we are trying to address, this HIV morbidity, and the culture. For example, if you have to go to the tribal areas, they have their own way of thinking. They think it's a taboo. I don't want to test, like Dr. Omelu just said it, you know. But maybe we want to get somebody from that same area, that environment, who they trust more to deliver this information, use it as a role model to deliver this information to them. So the aspect of education is a great aspect, but we have to look at the strategies on how to present this education to the target audience. That's my contribution. Thank you, Dr. Omelu. Thank you, Dr. Mbangowah, for this wonderful presentation. Because this is the issue of our day, especially the African American population. The prevalence is very high. Thank you very much.
Thank you.
Thank you, Dr. Rosen.
So much. And this also becomes important. You know, I grew up in the 80s, right? The new generation right now do not even, like, if you're talking about HIV, they do not understand, right? People didn't understand the trauma HIV caused in the 70s, in late 70s, moving to 80s. It's like the society was like it's like hyped up society like on crack, because people were scared. I mean, the only thing that scares now new generation is COVID-19, right? But before COVID-19 was what they call HIV and AIDS. It did happen. So it's unfortunate 45 years later, it's still there lingering around. And while it's lingering around, trust me, mutation is happening. Okay, mutation is happening. What do you think will happen if another mutation happen within HIV that's really, really bad and serious, and then boom, it starts spreading like a wildfire? So that's why when I do this show, when I have already two people, Dr. Katie Ngona, Dr. Mbangowah Nanda has done this study on HIV, and I'm trying to create an awareness on this issue. The federal government, the state government, the local government, the global community need to pay attention to HIV. Let's see if we can eliminate this disease from the population. And if we do, it will be a good thing for the overall global community. Another thing that Dr. Oben said that's important to me is also risk stratification, risk reduction, risk assessment, and risk reduction counseling is very, very important. Clinical settings should be doing this. There's an idea called one-stop shop, whereby even if somebody comes in for maybe, I know they do this in childbirth, pregnancy women, they automatically test, but there should be a way to just inform people about HIV, even if they're coming for prostate cancer screening or something like that. Because what we also need to know that there's a specific, I think it's called sarcoma, specific type of cancer that in fact HIV virus causes, right? The same thing when you talk about HPV, you're not talking about only human papillary virus or what it does as an infectious disease, but it also causes different types of cancer like cervical cancer and stuff like that. So you see how now, and this is true with COVID-19, we see how an infectious disease can just transfer, move away from being infectious disease and cause chronic conditions. So the integration is happening, and we need to wake up really fast and realize there's integration between infectious disease or viruses that can lead to chronic condition. And I agree with you that we need to have a system whereby we need to become champions in the community. You know, like, for example, what I do now with Papalic, you know, championing for a lot of health condition and creating awareness. And now I need to throw the curveball to my audience. Now, please, if you really want to be part of the champion and do and support what we're talking about, go on YouTube, subscribe to my channel, which is Papalic. I'm gonna show it at the end of this, so you know. But go to YouTube, type in Papalic organizations, and organization, not plural, organization, and then subscribe to our channel. When we do podcasts like we're doing right now with Dr. Mbangowah, I will post it on YouTube. You will get automatic alert that something has been posted. If it's some content that you like, you can watch it and share it with your family members. You know, last 2 years, I did a podcast with well-known Dr. Anderson on colorectal cancer. And one of the stuff we discussed in that show was about how the prevalence of colorectal cancer will go up, right? Lo and behold, 2 years later after that podcast, I was seeing a lot of literature, a lot of news that colorectal cancer is one of the 4 cancers now that is affecting younger population. And we have predicted this 2 years ago. So I think we should all be participators in this advocacy. We can't just stand by and let other people do the job. We are, if you look at what's happening as a movie, you are actually in the movie. You are actually in the matrix. You are actually participating in this matrix and in the movie. So why you want to be a participator? Participate in positive social change. And that's what I advocate in this show. So that being said, does anyone else have any type of comment or question they need to pose? Sorry, guys. When we're over time in projected time, I wanted to do this show, but because of how HIV, how we all feel about it, that's why this is going beyond the proposed scheduled time. Any other questions, comments? Okay, so since nobody has any comment or questions, in closing, I will say to Dr. Mbangowah, thank you so much. I'm really humbled that you accepted this invitation to come to Papalic Show to present your work. I really appreciate it. I know that we had scheduled it last year, but there's too many. My schedule was full with other shows that I was doing, and that's why it didn't happen last year. But I'm finally happy that it happened this year, and it's the first show that we kicked off to start this 2024. Next month, there's gonna be another show. I'm gonna be doing shows in every month on different health topics. So thank you so much. And I will turn it over to you, Dr. Mbangowah, to give any closing remarks.
Thank you. I want to first give a shout out to the audience and also to those who were able to participate. It is a learning process, and we welcome your comments. Even after the show, the comments will go a long way to improve on other discussions and other research topics that we are working on. I also wanted to say, I see some of my classmates here. I am proud that we are here together. And I want to say there's a lot of potential out there that we need to exploit and use what we learn. It is only after I started working on this that I met a friend that I wanted to share the information, and she gave me a website on how to apply for grants, and even requested, oh, I can help you out if you want to. You can publish this, you can take it to another level. So I'm just sharing this so that all of us, we can learn. And if you don't ask questions, you never get responses. And if you don't talk, you not know what you don't know. So it is better to talk and learn from our errors and correct ourselves. Thank you so much for giving me this opportunity today. And I am glad that I was able to brave it today, because each time I say time, but thank you so much. It finally happened. I am blessed to have this talk today.
Thank you so much, Dr. Mbangowah. And the slide I'm sharing right now is our YouTube channel, Popholic, P-U-B-H-O-L-I-C, a show and podcast. Please, if you really want to support us, go on YouTube right now, type this in, subscribe to our YouTube channel. This video will be posted on YouTube tomorrow so that you can have the opportunity to be active participators in this issue and share the video with all your families, friends, colleagues, and networks. This is one of the way, not the only way, but it's one of the way that you can support this movement. Okay, thank you so much, everyone. The goal of Popholic is to continue to improve healthy discussion in different areas of public health injustices, whatever it is, improve healthy people and improve healthy communities or environment. Thank you so much for attending this show, this HIV podcast show, and I really appreciate your time. And I'm really humble and sorry for going almost 30 minutes over 30 minutes over. Thank you so much, and have a wonderful day. I appreciate it.
Thank you.